latest updates, subscribe to News 9.
The health experts are alarmed by the surge in COVID-19 cases in the country. Experts state that India is on the way to top the list of countries with maximum number of infections. The recovery rate in India stands at 70.37%.
India is the third most affected from COVID-19 now, but with increased testing, it could emerge as the top country affected by the pandemic. While testing rates have increased by 240% since the beginning of July, COVID positive cases have increased by almost 325%.
According to the experts, the patients are taking longer time to recover from COVID-19. Several recovered COVID-19 patients are now reporting lung damage, shortness of breath, and respiratory ailments. As a result, AIIMS has decided to start a post-coronavirus recovery clinic in Delhi. The clinic's main role will be to monitor cases related to post-coronavirus recovery.
Since our recovery rate is now increasing, we now need to focus on the recovered coronavirus patients. We will be starting a post-recovery clinic for such patients at AIIMS. Those who have recovered will be evaluated on their residual problems, whether it is a heart problem or an effect on the lungs.
Many scientists stated that COVID-19 patients could be affected with shortness of breath for months after their battle with the virus.
Some patients are experiencing what is called post-COVID sequelae. Some have reported lung damage or need oxygen even post-recovery. Some are reporting shortness of breath. There are milder symptoms also, such as body aches, fatigue, and laziness.
Several doctors treating COVID-19 patients have reported that the virus will not only have a long-term effect on the lungs, but also other parts of the body.
We will focus on improving the lung capacities of recovered patients, whether it is through exercise, yoga, diet, or even through medicines.
The residual effects of COVID-19 reported by patients post-recovery are long-standing dry cough, malaise, and generalized weakness. Oxygen dependence secondary to a variable degree of lung fibrosis. Several patients may also develop distress secondary to prolonged hospitalization, social withdrawal, and social stigma. To avoid such complications post-recovery from the disease, people need to drink adequate water and must avoid mosquito-borne diseases. India is currently working on studies to assess recovered COVID-19 patients. At present, the country has a total of 23,29,639 COVID-19 cases, of which 6,43,948 are active cases and 16,39,600 discharges. The death toll in the country stands at 46,091. Even though the country has been successful in keeping the fatality rate low, the pandemic is still penetrating deeper in India.